My name is Scott Southron, and I'm the CFO for True Connect Communications right here in Los Angeles. I've been on a number of boards, and I think that's an important role. I mean, knowing what board governance is as opposed to running a company is a different ballgame. So I was a very sickly child. I grew up with asthma and was in the hospital a lot as a kid. I spent 3 or 4 birthdays as a kid in the hospital. Decided I wanted to be a doctor. Started pre-med. And quickly learned that wasn't going to be my profession. Spent most of my life in Orange County. I ended up going to school at USC. I went there to swim. It was a great opportunity. My folks are both UCLA grads, so they weren't necessarily thrilled, but the education was a lot cheaper when you're on a sports team, so it worked out well. I graduated with an accounting degree, but always have had, an affinity for the health field. I spent a lot of years in the hospital, and I wanted to get back. I've had over 20 surgeries. I actually have 3 fake joints. I have an ankle, a shoulder, and a hip. So I've beaten my body up over the years. I was a swimmer. I ended up swimming through college. And then I swam masters till I was 45 years old. I spent a number of years with the 552 Club at Hoag Hospital, which is kind of a young executive group that was fundraising for Hoag. For the last 12 years, I've been in the telecommunications field. True Connect is a company that provides what are called lifeline services for the underserved community, the low-income community. I think what I can bring specifically, other than just 40 years in business, I've been in regulated industries, and I understand regulated industries in the telecommunications field. We do a lot of real estate deals at PIH Health. We buy and sell real estate. I mean, that's a big part of the business, and I've got a lot of industries in that field. I want to be a tool for the management team when needed. I think my greatest strength is my desire to do the right thing, to be committed, to be involved, to get out and meet people. I love going on tours and seeing, the nurses station with people that are smiling and happy. After being in a lot of hospitals, that's not always the case. And so I think it is just my desire to continue to be involved, to continue to learn, to leverage my, 40 years of experience, and whatever that is, I can bring. I was married for 23 years. I have 2 boys. It's really fun to see your kind of kids turn in from, kind of knucklehead young boys to men and be fathers, which is pretty incredible. Just became a grandfather about a year ago. So my role at PIH Health is to be here a long time and see which one of those, things in my background really makes a difference.